Adult circumcision is a different procedure to the one we do with children. Up to puberty, I use a very simple technique known as a plastibell. In adults, it is a longer and somewhat more complicated procedure, but still very easily conducted in my rooms. It's something known as a sleeve technique, and it involves using some very specialised electrosurgical equipment and stitching up the foreskin. It takes around an hour to do, somewhat longer than a plastibell procedure in children, of course, but it's not an ordeal for my patients. I find that they usually find the experience relaxed. The plastibell is a little ring device. It's been practiced in Australia for over 40 years, and I think it's likely to be the most commonly utilised means of circumcision in Australia for pre-pubertal boys. It's a little ring that will go over the head of the penis. The foreskin will come over the top of the ring, and then we put a tie around that. Very simple, a bit like docking the tail on a puppy. That tie is tied very tightly against the ring. We trim off most of the foreskin on the day, leaving around about 1 millimetre or so in front of the tie, just to keep the ring and tie in position. The value of a plastibell circumcision is it's designed to take off the right amount of skin. The device helps guide that. You get a nice neat edge to the circumcision, and because the tie goes on all the way around the circumference, it occludes all the blood vessels, pretty much eliminates bleeding risk. I've done more than 8,000 plastibell circumcisions. I think I've had 30 or 40 bleeding incidences in that time, and touch wood, nothing serious.